Hi, my name is Jen Berkman, and I'm the marketing manager with Medical Specialists of the Palm Beaches. We're here today with board-certified family medicine physician, Dr. Emilio Fernandez. So good to see you today, Dr. Fernandez.
How are you, Jen?
Yeah, I'm glad you're here.
Thank
Welcome
you.
to the
Me
group.
too.
You're new.
Thank you. Yes, I am. Thank you very much.
We're so excited to have you in our group.
Me too.
That's good. It's awesome.
Mm-hmm.
So our group is growing, basically.
I know. I noticed that.
Yeah.
Compared when I started at JFK, it's huge. It's bigger than before.
Right. So I have my first question for you.
Okay.
If you could be anyone for a day, who would it be and why?
I would like to be, I would say a very experienced researcher, especially in cancer, which is even though we know a lot lately and we have the technology, we still need to know a little bit more, especially medication-wise, to decrease the side effects, to pinpoint to the minimum, not to avoid any side effects, because that the patient sometimes say, I don't want a chemo because it's more harmful than what it is, the result of the treatment. Not in everybody, but a lot of people usually complain of that right off the bat. They say no. And then, I would like to do that kind of research, especially like that.
Okay. Wow. Yeah, we definitely need a cure for all cancers.
Definitely.
So that's really noble. It's really great. So my next question for you is, why did you decide to become a physician?
Well, it might be a funny story, but I was around probably 13, 14, and my girlfriend's stepdad, I felt unwell, and he went to see me, asked me a couple of questions, examined me, and said, you take this, and in a couple of days I was up and running, and I was like, wow, I would like to do that too, just taking care of people. So it looks so easy, but I didn't know at that time. But it's very interesting. That's the reason I decided to be a doctor.
Oh, okay. That's fascinating. So that's your gifting and your calling, because
Literally.
you
That's
literally.
what it was, yes.
So what a great inspiration.
Mm-hmm. It was. That was the first doctor in my family. Actually, the only one.
Huh.
So they didn't like to work too much.
Oh my. So my next question for you is, what do you wish people knew about family medicine?
That's a very important question. People need to know that family medicine or primary care doctor per se is just to help to keep people fit and healthy, to keep them away for developing or at least slow down any chronic disease or acute diseases on time. Know that people waiting and they just with a one visit to the doctor and follow the instruction, it would be easy just to avoid any complications or any kind of disease.
That's what it is. So true. Mm-hmm. Preventive medicine.
Preventive. That's the best medicine.
Mm-hmm. So our next question is, if you could give someone some advice on how to maintain their health, what kind of advice would you give them?
I don't want to say nothing funny, but before I get to that, I met a couple actually. They were 92, 95, and she said to me, if you really want to get that long, all you have to do is behave until you reach 60. After that, do whatever you want. That's not a good advice, but apparently worked for her. But definitely, people need to always, because your body is like your temple. You don't let anything into your body unless you agree with it. When it comes to what you eat, exercises, sleep well, try not to be angry with us. If you upset for anything that is not that important, that goes against you, you have to keep your good vibe. And then, equilibrium with everybody, try to be nice to everybody. I know, sometimes minor little thing can make you upset. But my basic advice is, like I said, be healthy, is like eat well, do exercise, and rest. That's the first three things I would say to anybody. And of course, go to see your primary care.
Wow, that's very profound, very true. So our last question for you is, give us a story about one of your favorite patients.
That was when I was in the residency. Happy that I went to Little Rock, Arkansas, and then I would do some of the office training in a little town called El Dorado, Arkansas. And I had a patient that at the beginning was kind of hard to communicate because, it's really heavy a Southern accent, and I'm Cuban. So to me, it was the first time I went to the South, and I had to have the patient's granddaughter to pretty much interpret what I said, because it was like, what did he say? What did you say? You know, back and forth.
Oy.
And the second year of my residency, it was just himself, his wife, and me. And then his wife was the one here and there to fill in the blanks. And the third year basically was just both of us, nobody else but both of us. And he asked me, "Oh, I'm so glad that you're graduating pretty soon, though I can follow you when you open your office." And I said, "Well, unfortunately, Ernest, I'm going back to Florida." And the guy said, "Really? Now that we don't need translation, nobody, and then we can communicate without no problem, you abandon me?" He said, "Well, unfortunately, it's a calling. My wife wants to go back to Florida." And that's what happened with that.
Oh, wow. How funny.
It's a true story, though.
I mean, I believe it. I believe it. Wow. Well, we're glad you came to Florida.
Yeah,
now
me
you're
too.
with our team, MSPB.
Yep.
So
you're right
thank you
about
again
that.
for being with us.
No, thank you. You're more than
Thank you
welcome.
for watching us today.
Okay.
And please like us and follow us on YouTube, Instagram, and Facebook. See you soon.